Well, my name is Benjamin Lefevre with Certintell Telehealth, and thank you for listening in to this webcast. The title is The No-Nonsense Guide to Go Live with Telehealth Services. We all know healthcare delivery has been changing for quite a while. We didn't know that it was going to change this quick with COVID-19, but this is an opportunity to really reset where we're in this new normal, again, how healthcare is being delivered remotely. And this is kind of a funny cartoon that we start a lot of our presentations with earlier on before COVID-19. I really want to thank you for these great telepsychiatry sessions, doctor. The format lends itself to easing my anxiety and feelings of inadequacy around others. Again, this really goes to show how healthcare delivery has been changing, but how it's really changed in this new normal post-COVID-19. And so really the goal and opportunity today is kind of reset, as people are able to take a little bit of a deep breath and kind of figure out what's next. How do I need to look at telehealth and to really make it a sustainable program for some of you that maybe are just getting it kicked off in a more sustainable way. We'll talk about that, things you need to think about, the specific steps going forward. So we always want to start is what is telehealth for folks that are now starting to look or starting to implement it, to be very clear of what the American Telemedicine Association, the telehealth resource centers really put down as the different modes of telehealth. All of you know and have started or launched or in the process of launching post-COVID-19 is virtual visits, which is synchronous. And that's the one that most folks know, video conferencing. Many of you started with Polycom equipment, maybe advanced to tools like Zoom, and in this COVID-19 emergency, just using whatever tools you have to connect via video, whether it's HIPAA compliant or not. So some folks are probably using Google Hangouts, FaceTime, Skypes, but all of that falls under the mode of virtual visits with a synchronous communication between patients and the care team. One that's also starting to grow and folks have experienced as well is what's called store and forward. And again, these other modes are important because, again, in post-COVID-19, payers are starting to reimburse for not just the synchronous, but also asynchronous as well. So think of teledermatology, think of teleradiology, where you're able to send images, photos, data to a specialist. They view that and then send back recommendations at a later time. So that's what's called store and forward. And again, these are starting to be reimbursed and billable in some Medicaid plans as well as Medicare. One of the more exciting areas and a strong interest around COVID-19, particularly as many of the folks that unfortunately that are high risk of mortality around COVID-19 are folks with chronic conditions, high risk patient populations, and remote patient monitoring has really started to take off. So what that is it's not doing a remote exam, but it's actually placing devices in the patient's home to monitor their overall health. So think diabetic with a glucometer, hypertension, heart failure patients be able to monitor their blood pressure and just an overall health, for example, provide them a scale. And anytime a patient steps on the scale, takes a blood pressure reading, that data flows real time to the clinical team to engage the patient with the real goal of self-management, hospital avoidance, and lowering the overall cost of care. So mobile health, that encompasses a lot of different things, but just engaging patients with the devices they use every day around education, sharing information, overall nutrition, health, any of that type of engagement through smartphones is considered mobile health. So let's talk about some telehealth use cases. Many of you in the health center space have utilized telehealth in some form or fashion around this, and others have now started to use it in some of these other ones post-COVID-19. But what's the goal of telehealth? Of course, it's providing access to care to patients when they need it, at the time, when they need it, and to really improve overall health outcomes. So when we talk about improving efficiencies, that's where health centers have started to, before COVID-19, start to expand their telehealth use. Maybe you have one behavioral health provider, but multiple clinic sites to be able to engage remotely between the sites to be more efficient so patients can get access to service they need at their most closest location. Certainly the earlier and most common use case for telehealth in the health center space has been, for example, contracting with a psychiatrist or specialist to provide services to more rural and underserved areas. And then you started to see on the bottom right, urgent care after hours. That's been really growing in a direct-to-consumer, commercial payers, and hospitals are starting to offer for low acuity, non-emergent type care on demand as well. And then everything in between, folks can deliver via telehealth. So chronic disease management, we'll talk a little bit about more of that in a moment. When patients have a hospital event, post-discharge, engaging them around medication reconciliation, any type of remote care is telehealth. So we talked about in multiple use cases there. So let's talk about the types of users for telehealth. What's great about health centers, you all incorporated behavioral health into comprehensive primary care, dental, pharmacy. All of these are great users and can provide strong value to the patients via telehealth. Typically, behavioral health providers are where most of health centers have started using telehealth. I mentioned about contracting with psychiatrists, but now post-COVID-19, as many of you attest, engaging your primary care providers with patients in the home for follow-up visits, annual wellness visits, just overall, E&M visits is really a growing area for telehealth around COVID-19. So let's look at, some ancillary clinical staff. So, reaching out to patients around nutrition, health education, all of those community health workers, folks are now seeing the benefit of telehealth from an efficiency for staff to, again, engage patients in between their office visits at home to really improve overall health outcomes. And so one of the bigger areas around chronic care management is using clinical staff, what we call health coaches, to really reach out to patients into the home to talk about, overall healthier living, self-management, improving health outcomes, and the like. So it's interesting when you look at CMS and Center for Medicare and Medicaid Services, and really there's been a focus on telehealth, but certainly around COVID-19, multiple quotes, and just talking about the incredible growth of telehealth and how it's really helping promote remote engagement. And, as far as giving remote doctor visits and hospital check-ins, all of that has been a big push and focus, and really been a significant commitment from the Center for Medicare and Medicaid Services to continue to support around this COVID-19 emergency. So what we're going to do now is get into a little bit more the nuts and bolts of, how you want to kind of set your mindset to be successful as you look to start or scale your telehealth services. And so there's an interesting method called the SET method, and it's straightforward. Most of you all are as you look at telehealth now after, COVID-19 and kind of the craziness of just standing up a solution to drive engagement and patient visits. Now you can take a step back and really look at this in a sustainable, systematic way. So introducing the SET method, it's very straightforward. Survey what resources you have, execute the plan you have defined, and transition any processes that need improvement. So when we talk about survey, you really want to start to define, okay, who's the team? Workflows, as we know, are critical. Certainly you being sustainable, you have to review review state laws from a compliance perspective, but there are some really great resources out there to do that. Certainly the CPCA that is a great resource. There's a couple, many of you belong to a health center control network. I can tell you that the HCCN's one of their core focuses going forward is telehealth and implementation, remote patient monitoring, everything we talked about earlier, and as well as folks that are there to support efficiencies, administrations like a group purchase organization. There are just some great resources that now around COVID-19, telehealth is a focus, bringing in the best information and resources to be successful. So, and one of the best resources by far is the Center for Connected Health policy. And they are super responsive. They are always on top of the changing landscape around reimbursement laws and policies, which is critical, again, around can we bill for this? Are there restrictions on the patient locations, the type of providers that can provide this service, not just Medicare nationally, but also at the state Medicaid and MCO level as well. So I encourage all of you all to bookmark the website here and go to this daily, because they update the information and resources daily and doing a great job. So as you look at kind of a checklist, as you look at what types of goals, what are your gaps in your patient population and milestones, these are some important things to focus on initially. Again, many of you needed to get telehealth up and running, do something in the interim, but as you can kind of take a step back and survey the whole situation, there's some key things you want to think about. So again, define the initial goal of your telehealth program. Some it's just, right now we want to be able to drive billable events. Others, maybe it's more focused on, okay, how can this support our mission of improved quality measures, quality improvement, what we're charged to do to provide accessible care. Maybe that's a goal. If you are shifting to some advanced alternative payment models, how can this help us meet some of those opportunities in shared savings and shared risk, or even capitated plans and others. But again, the initial goal is really define your goal of your telehealth program. You may have multiple goals, which is fine. You also want to outline specific gaps in care to your patient population have. So many of your health centers are rural. Certainly that's one of the great things about community health centers, that they're in most communities, but still some patients may have to travel a little bit of distance, or certainly around COVID-19, some patients are, confined to the home. And so understand, what are the challenges and gaps of getting access to care for your current patient population. And then set measurable milestones, improve patient outcomes. Again, what we found with telehealth is that from an efficiency standpoint, providers, once they become part of their norm, they're able to be more efficient, see more patients, and really feel better about their job as well. But multiple areas to think about. And again, looking at agreeing on specific services you want to offer. So most start with mental health engagement around COVID-19. Primary care is really at the top of the list of continuing to provide services to patients. Or, are you also looking at maybe patient-led kind of on-demand urgent care offerings as well for low acuity, non-emergent type visits as well. So when you, again, execute, we're going to get into, state laws and things you want to think about when you look at a potential partner around telehealth from a vendor perspective. So again, have you reviewed all the state laws and local affiliates? It's now time to choose a solution that really fits your needs. And I'll go back to, what we've seen again around COVID-19 was, and we understand it's just like get something up, doesn't matter what it is, Zoom, Skype, FaceTime, to drive billable events. Again, as you're looking for a long-term solution, maybe you've found one, but you want to know maybe what other opportunities are out there from a platform. As I mentioned, video is just one core component of it. There are multiple modes of delivery of telehealth, and how can we maybe look for a solution that provides all four of those? So some questions to ask. Does the vendors, is it HIPAA compliant? Medicare and most Medicaid all waived the need for a HIPAA compliant solution around this the pandemic, but certainly something that's secure, compliant, protecting your clinic, protecting your patient's data is of utmost importance, and we know that's going to be rolled back. And again, ask them, do they have any type of certification? So, High Trust is one, but there are other vendors that really look at with a fine-tooth comb, going through the vendors about their security practices and protecting that data, particularly as you start to get into tools that go beyond video connectivity when you're sharing data through store and forward or certainly remote patient monitoring. And as I talked about, segueing into, remote patient monitoring or RPM, again, does it provide some scalability to go beyond video to really make an impact on your high-risk, high-cost patients by incorporating tools like remote patient monitoring, and then and also what is the patient experience through the tools that you use. I think many health centers we've talked to have learned a lot around this, around COVID-19 and pandemic, is that yes, it's nice to have tools that have apps and things like that, but it's got to be easy for the patient. Typically, sending a text message, the patient clicks on the link and they're connected. Again, you only learn this by trial and error and getting out there and trying different things. But again, does the technology value the patient experience if it can't be seen in person, being able to go beyond just simple video conferencing to really impact high risk, high cost patients in improving outcomes. So again, looking at the process, who's all involved, is everyone understanding the program and what the goals are also critical steps. So, ensure that, everyone has hands-on training. That's a key part of that too. There's a role to play for folks that are scheduling the telehealth visits or engaging the patients, setting up the patients with the equipment for remote patient monitoring. Does everyone understand the workflows? These are all critical to success. The technology is one piece of it, but how you use and incorporate it into what's important to you, the goals you have in the program are just as important. And one of the things we want to share is an example of, two partner clinics and workflows they created, particularly around the COVID-19 pandemic emergency, and give you a high-level example of one of your fellow health centers. So one is, providing a clinic workflow, where the schedulers of the telehealth, they are supporting providers in clinic. So patient is entered into the EHR, appointment begins, the MA or implant documents the vitals, patient roomed, and then the patient creates an appointment, and the provider is notified that the patient is ready. Provider reviews the chart and starts the video session, and then the provider completes and then visits and then documents that in their EHR. So that's one example, just from beginning to end, and you can think of the whole team here, the important part of the MAs, LPNs, schedulers, as well as, of course, the provider and the patient, and how that workflow in the clinic has been successful. And then, the examples of where you want to turn in, where a patient either is calling into your call center to maybe say they can't make it in or cancel, and then you're able to turn that patient schedule call through the call center into a telehealth visit. So patient calls, received in call center. Call center agent schedules appointment in the EHR, and call center agents schedule a telehealth visit. And again, this is applicable for, multiple solutions, opportunity for the patient to basically through a text message link, through a quick appointment, be able to connect and connect through the video solution. And then the provider completes the documentation, and completes and ends the visit, and then and also the provider starts a video session again, and the provider reviews chart in EHR, and again the patient arrives in the EHR. So again, it's a cycle. It continues to flow between the call center, MA, LPN, the provider, and how they schedule and document the encounter. So transition, learning rapidly. There will always be workflows and processes to improve. Certainly you want to, again, from a sustainability, make sure you're making telehealth services sustainable by understanding the ROI. Are you submitting the claims correctly? Are you able to bill for the services? Who can bill? What are, of course, any restrictions on the patient location? But continue to review those and continue to improve the process. And we found that health centers that struggled early on have pretty quickly found a way to get very efficient through their telehealth workflows. So again, allowing feedback from your team and staff anonymous. Certainly telehealth is a necessity today, but you also want to be conscious of team members that maybe aren't coming along as fast as you would like, but be able to provide open and honest feedback, because then you can provide that back into, maybe it's a technology issue, maybe it's a workflow issue, or maybe it's a billing issue, not getting paid for the visits, all those different things. But you want all of the departments to be able to provide, consistent feedback and honest feedback to make it as successful as possible. So again, looking at measurements, it really is about the patients. Do they understand the process? How do they feel about the telehealth consult engagement? Checking in with them. Do they like it? Is this something they would continue to do if these restrictions are not rolled back as you all started to stand up a solution? And again, ensure your team is working toward creating the best possible patient experience as well. Some training around, how to deliver telehealth consults. It's certainly different than in office, making sure that the providers or care teams are aware of their surroundings and their location, communicating with the patient. Where are they? Are they in an area that's conducive to an effective, consultation as well? And of course, you cannot forget the provider perspective. The providers are critical to success. Again, going back to that feedback from, providing that, how satisfied are they with the workflows? What can be done to make changes if needed? And of course, measure. Particularly the patient outcomes as you start to engage beyond video with remote patient monitoring and other tools. Are you seeing some quality improvement, lowering readmissions, all of these key tools that now folks are ready to explore, and how telehealth can really help meet their patients' goals. So in conclusion, what's the most important step? The most important step from above is what comes after transition. This is a learning cycle. It's not a start to end, solution. And after the transition comes repeat, and make sure everyone is referring back the core teams around, everything that's critically that we talked about. Are we meeting the compliance? Do we have something that's HIPAA compliant and secure as those restrictions are put back on? Understanding, the key stakeholders that can support success. Certainly you're one health center, but when you wrap up to the CPCA or the Health Center Control Networks, they are there to help you facilitate best practices and learnings from other members as well. And so again, regularly contact your vendor partner if possible. That's why it's important. Again, you want a solution that works, that's effective, but you also want a partner that's willing to work with you and work within your workflows that work best for you and your health center and your patients. And again, ensure your staff is educated and know that improvements are coming to the telehealth solution and process, that, folks are listening to us. We're heard. We're going to make this a success, long term. So good solutions take time. Post COVID-19, this is a real opportunity to kind of reset and look at, how can we be more proactive in how we innovate and the tools that we use to really meet our goals of improved outcomes with the underserved low-income patients. And again, I like this, I want you to find a bold and innovative way to do everything exactly the same. It's been done for 25 years, but I think we all know we're at a stage with COVID-19 and post that, this new normal, that we can't go back and do it the same old way. But again, you have a team, you have a group through the CPCA and other health center that are really in this together to make a difference, and I know you all will be successful. So if anybody has, and again, questions, you can, around reimbursement policy, the Center for Connected Health Policy is a great tool. Go to that website as well. Here in California, it's always updated. It just has great information. And then, of course, on our end, as we've been out there with health centers, educating, implementing tools around remote engagement, remote patient monitoring, chronic care management services, and learned a lot on what works and what doesn't work from a workflow perspective. Certainly, please reach out to us as well. And thank you for your time.